Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 6, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. 6 new cases were added to Dubuque County's total today. As of May 6, Dubuque County has 162 positive COVID-19 cases, 2 in the 0 to 17 age group, 55 in the 18 to 40 age group, 64 in the 41 to 60 age group, and 33 in the 61 to 80 age group, and 8 that are over 80. To date, we have a total of 5 deaths in Dubuque County, 4 of which are in the older adult category, age 61 to 80 years old. Currently, Dubuque County has 18 COVID-19 patients who are hospitalized. Also, 1,697 people have been tested in Dubuque County with 1,535 negative results. So 9.5% of the cases tested have been positive. 29 people, or about 18% of Dubuque County positive cases, have recovered to date. The state added 293 positive cases today for a total of 10,404. I'm sorry to report 12 additional deaths are reported in the state for a total of 219 Iowans. In all, there have been 63,171 tests, and currently 407 cases are hospitalized throughout Iowa. About 36%, or 3,803 Iowans, have recovered. We continue to try to plan for our community, whether it's if or when businesses will be able to open up on May 15, 2020, or what will be open this summer. What youth programs will be available? Will swimming pools be allowed to open? Many organizations are trying to put new mitigation strategies and social distancing in place as they plan their future programs and ways of doing business. Please be patient as we all try to incorporate the current status of the pandemic plans as plans are made for the future. Also, we know we need to use the history of previous influenza pandemics as we make these plans. Why are we using influenza pandemics as a guide? Even though the coronavirus and influenza viruses are very different, they do share similarities. They are both novel or new viruses to humans, as in every year we have a new influenza virus, which means we have very little immunity. Secondly, they are both spread predominantly through respiratory droplets and smaller aerosols. Also, coronavirus and influenza are capable of rapid worldwide spread and the ability to infect a lot of people. Also, according to the Center for Infectious Disease Research and Policy, there are other factors related to COVID-19 to consider. Number 1, because of longer incubation period, more asymptomatic spread, and a higher R0, COVID-19 appears to spread more easily than flu. A higher RO means more people will need to get infected and become immune before the pandemic can end. 3, based on the recent flu pandemics, this outbreak will likely last 18 to 24 months. 4, it likely won't be halted until 60 to 70% of the population is immune. 5, depending on control measures and other factors, cases may come in waves of different heights, with high waves signaling major impact, and in different intervals. This is what we mean by a potential resurgence in the fall or winter. So we need to continue to think about these factors as we plan for future events and openings. Finally, today I want to continue to stress to everyone to take the Test Iowa online assessment at testiowa.com. Even if you are not symptomatic or have not had contact with a positive COVID-19 case, it's important to still do the assessment. The assessment asks questions about underlying health conditions and whether you are an essential worker or a critical infrastructure worker. Collectively, this will provide information to determine Dubuque County's risk level for more COVID-positive cases. More Dubuque County residents completing the Test Iowa assessment will demonstrate the need to the Governor's Office for a Test Iowa site. Also, once you take the assessment, Test Iowa will notify you electronically to reassess your symptoms on a regular basis. So please, take the online Test Iowa assessment at testiowa.com. And if you know someone who does not have access to the computer or the online survey, help them out by filling it out with them. Thanks for tuning in today. Let's all continue to be safe, be smart. When in doubt, don't go out. And remember, we're all in this together.